Hello, Dr. Wadsworth here at Uintah Spinal Health. Another injury that we see commonly with youth, and those who are active youth or starting to get active, are shin splints, posterior, anterior shin splints. We see this a lot with those who are increasing their miles without being trained for it, or increasing their miles rapidly. They're untrained to run at that time and just running a little bit more than they were used to. It's just a conditioning thing that we can treat and help get you back to running the miles that you need. So what the shin splints are, anterior shin splints will be pain along the shin here, but more in the front. That's anterior shin splints right here. It comes down, this muscle comes up here and attaches to the bone, and the bone up here, and we're having pain right along the shin in the front. Posterior shin splints would be near the back, right along here, and right along the shin again, but near the back on the inside of the leg, right here, coming down. Sometimes it's going to go here. Again, that's more so when we increase miles, change something in our gait, or change shoes possibly, change what we're running on, asphalt versus trail running itself. But these shin splints can come from just some dysfunction in either your dysfunction in the ankle itself. Maybe your ankle's not moving very well, so the muscle is activating more. It's more on its own. There's many ways we can do to treat this to help reduce the pain as you are training to increase the miles and continuing to run. We can treat this to help reduce the pain so you can continue on with your activities as best we can. Okay, ways we can do this are with, again, instruments to scrape or to instrument assist the muscles itself, increasing the blood flow to heal. So I do some scraping like this, just along the muscle. Okay. There's cupping if we need it. Cupping again increases the blood flow. Do a combination of all this treatment, not just at the site of pain. This is posterior shin splints, but also above and below. We'll find what areas, what muscles are tight, what joints need to be worked on, and then a lot of times it's the tight muscles. So here I see a lot of this muscle's tight, or the lateral fibular muscles, peroneals. Here's a muscle stretch technique, or an ART treatment. I'm going to find a trigger point or a tight spot in the muscle. I'm going to pinch the muscle and then stretch out this way. And find a couple of different spots. Just repeat this a couple times. Try to work on the muscles that are tight and loosening them up with my hands. Do the same thing on the inside. And here we go in and out, in and out. Other things I do are dry needling. Put some dry needles in the muscle to help reduce the fascial tightness, the muscle itself. And then if the ankle's not moving very well, or the foot's not moving very well, I'm going to adjust it. So Aaron has a spot right here. Adjust the joint itself to get it to move a little bit better. So and the foot here. Okay. So do that. You can also put some tape over it to help giving you something at home to do, or to keep at home. Posterior shin splints, place it over, and then another piece over the primary pain point. And then on top of that, what needs to happen are some proper exercises to help mobilize the ankle, strengthen the muscles itself around the shin splints, and keep things moving to condition the muscles in that aspect. And I'll go show you those.